Good morning, everyone. I'm Bob Ravenscroft, Vice President for Advancement, here for our March 18th briefing. I'm going to break this kind of into two parts, some really good news and then some cautionary or concerning information or perspective, certainly outweighed by the good news. Let's start with the good news. Right now, you can see are fairly busy here, but at the top line, we only have 13 COVID patients occupying hospital beds. Of those 13 patients, and it's kind of split 50-50, I believe 7 of them are COVID-19 and 6 of them are no longer infectious but still quite ill. Between the two groups, we have 4 in the ICU and 4 of them are ventilated. What you don't see on the screen, which is just really good news and a relief to our team, is we haven't experienced losing a patient in about 10 days. I think it was the March 9th morning report the last time there was one recorded there. So as you know, and those that have followed this closely, nothing's been harder on the team than experiencing that. So a nice relief there. Real quickly, as you know, we completed a Facebook Live series that was very, very well received. And Dr. Patera's, I just want to call that out. It was delivered exclusively in Spanish, and it had a viral effect that was quite significant. It was picked up by Telemundo, Nebraska, Lobo 97.7, Guardian del Sur de Omaha, Bonita Omaha TV, Hola Omaha, Omaha Noticias, and then there's a syndication of Noticias organizations and other organizations that propagated this message were Noticias, Alaska, Washington, Utah, Texas, Oklahoma, New Mexico, Nevada, Montana, Missouri, Minnesota, Idaho, Iowa, North Dakota, Colorado, California, and Arizona. I share this because we were just really pleased we were able to pass this information on, and it was so well received. And I think it kind of magnified to us some of the social determinants that were really magnified through COVID-19. There is a thirst for information, and it's probably a challenge to Bryan, to all of us in Nebraska and across the country, that there's a thirst for this information to get reliable health information and addressing the disparities that COVID so vividly magnified. So anyway, I just wanted to share that with us. Another piece of good news from a Bryan perspective is now all 5 former living presidents have endorsed the vaccination and urged Americans to get vaccinated. That is 3 living Democratic former presidents, 2 living Republican presidents. I say this because we're in a traditionally conservative state, and up on the screen you see some information from the Kaiser Foundation. They do really robust research into many things related to this. And there's a significant portion of Republicans that just said they weren't going to get it. So we're hoping the recent endorsement will help influence that, because we certainly have a lot of Republicans here in Nebraska. And we are strongly advocating from a Bryan perspective, as you know, for everyone to get vaccinated. So for members of the media or the public, I encourage you to go dig into this site. There's a wealth of information there that addresses this. A little bit on the concerning news. It's a short list, but the positivity rate in Nebraska is still quite high, and it is a very active virus, as you've heard from our physicians and all of us, discussing this from this podium. The other one is the B117 variant. As members of the media know, it is confirmed in Nebraska. I believe it's only 7 cases. There's such a small amount of sequencing done, so it's safe to assume there's more. But why it's concerning, it's not just the kind of topic of variants, but you are seeing Midwestern states of Minnesota, Michigan, and Northwestern, where they once plateaued like we have here in Nebraska, but they're now going in the opposite direction, and it appears it's the B117 variant that is gaining steam there. So, as preventative measures are relaxed, we, from a Bryan perspective, just feel it would be really unfortunate if what we've all endured is unwound. So we're really in a race against time between the vaccination and the public and governmental diligence. So we are imploring you or strongly advising, I guess I would say, to continue masking, socially distancing, and avoiding those large crowds where distancing requirements cannot be met. What this really all means to us, for those of you that have followed this for a long time, we once met daily with our pandemic team. And then it was meeting by Zoom daily. Just recently, we dropped that to 2 times a week. About a couple of weeks ago, we began only meeting once a week, and we have now moved to just written reports because the situation here at Bryan is contained, and the team knows what we're doing, supply, you name it. Everything we discussed is pretty well under control. So that is very good news. And we also have some project teams that are beginning to prepare for, the relaxation of a lot of things that involve visitation, masking, meetings, screening stations, and all of the operational ripple effects that will happen once we unwind those things. So I do want to stress that as those teams are working on that, timing's not determined when those will be released, but of preeminence importance is safety to our employees, to our patients, to our visitors, and all that enter our facility. So anyway, a lot of factors go into that. There's about 20%, smidge over that, of Bryan employees that have not received vaccinations. So what does that mean to internal meetings and so forth? All of that is being worked through, and we will announce that when it's time. I think we're several weeks away from doing that, though. I ask our friends in the media to continue to have that as an element of your coverage. It's really, really important to, from a healthcare perspective, to continue with the non-pharmaceutical preventions and let the vaccine get into more people's arms so we can all safely get back to normal rapidly. I heard it from our physicians. I heard it in the Facebook Live sessions from the physicians that premature relaxing of some of these standards. They used the analogies of being in the red zone when you're behind in a football game and you have a chance to win the game. You just don't want to fumble or miss your field goal now. So I guess, Brent, the suggestions are, if there's an opportunity for you to continue to advocate for the preventative measures that our medical staff have strongly advocated for since the beginning that work, we want people to do that. And then the precautions are, I guess, monitor the vaccination websites and get signed up as soon as you have an opportunity to do that. What I will say is our medical staff and all of us at Bryan are strong advocates for continued masking and continued strong personal decisions on the crowds you interact with and in what environments you place yourself in, because it is an active virus, and the variants have found their way to Nebraska and certainly states nearby. So that's really a question for those that determine what the directed health measures are. I think our position is very clear that those personal decisions around masking, social distancing, and hand washing are extraordinarily important. Obviously, here we've continued to see a downward trend. Do we anticipate? I'd say we're prepared for it. We're cautious and a little apprehensive that you could see it, but we are extremely hopeful, partly because of the way the community of Lincoln has responded, that we can kind of avoid this, but it remains to be seen, and I think it will be determined primarily by the community's behavior until we can get through the vaccination cycle. And the great news there is more and more are, as you know, coming online rapidly in the next couple of months. So I don't know if I would say anticipate. We're prepared for it, but certainly hoping that it does not get to that point. Part of the things these teams are working on is how valuable are masks when it gets to be cold and flu season. We've seen it work with, really stomping down the flu this year. I don't know if that'll be something there. I think long-term changes to healthcare in general, it's kind of why I brought up the Dr. Patera thing. What COVID did is really magnify some of the underlying social determinants that have always been there, but boy, it became front and center to see how the pandemic impacted some of those populations. And I think it's a responsibility for all of us in healthcare certainly at Bryan, state leadership, national leadership, to take a real honest look at how we're doing there in disseminating the right information and providing access to everyone. So yes, I do think you're going to see the healthcare system react to that and try to be more proactive in it. As far as the way people view healthcare, I guess that's probably not for us to say. There's research out there that physicians are, extremely trusted, and that's why we've been putting them front and center. I guess what we would hope we've been able to do through this is show that as a nonprofit health care system, we don't have shareholders to please. Our sole purpose for being here is to meet the needs of the community, and I hope that they see that we've done everything we can here, at least locally, and I think most cases throughout the state have done that. So I hope that it's trusted and relied upon in a very favorable, from a very favorable viewpoint moving forward. But that's really the consumers. I can promise you we'll continue to do everything we can to serve the community to the best of our ability, and hopefully that will result in positive views of healthcare moving forward.